Welcome to Ufahamu Africa, a podcast about life and politics on the African continent. I'm Kimmy Dion, one of your hosts, and I'm here together with my co-host, Rachel Beatty-Riedel. Hi, Rachel.
Hi, Kim, and hello to our listeners. We're so glad to be with you here as we are making our way into season 8. This week, we talk about vaccines, the Liberian elections, Africa's divide on the Israel-Palestine conflict, and as promised, our thoughts on the coup in Gabon that happened in August. And our guests this week are a set of extraordinary young leaders from Africa who were at Cornell University this summer with the Mandela Washington Fellowship program, who are going to be talking about health and public management and governance.
Yeah, and in the news about health, actually really exciting this week, the World Health Organization, the WHO, has announced that they are recommending a new vaccine, R21 Matrix M, and this vaccine is for the prevention of malaria in children. As we all know, right, malaria is a deadly disease that really affects so many people, especially children in Africa. And the recommendation follows advice from the WHO's Strategic Advisory Group of Experts on Immunization. They're called SAGE, right, because they're so wise. And also the Malaria Policy Advisory Group, and it was endorsed by the WHO Director General following a meeting in late September. Now, this is the second malaria vaccine to be recommended by the WHO, and both vaccines are shown to be safe and effective in preventing malaria in children, and when implemented broadly, are expected to have a high public health impact, right? This is the thing about vaccines. They can be individually protective, but they are the most powerful when whole communities adopt vaccination. And so, now we've learned that at least 28 countries in Africa plan to introduce one of these WHO recommended malaria vaccines as part of their national immunization programs. And Gavi, which is a vaccine alliance, has approved providing technical and financial support to rolling out malaria vaccines to 18 different countries. So this R21 malaria vaccine is expected to become available to countries in mid-2024. And as I've probably mentioned on the show before, I've been doing a lot of work about vaccines and vaccine hesitancy. And unfortunately, a thing I'm concerned about is some of the politicization or uncertainty that came with the, widespread availability of COVID vaccines, and some of the disinformation and misinformation about those vaccines is having ripple effects on other vaccines. And I hope that won't be the case for this vaccine and for its predecessor, right? These two anti-malarial vaccines, because malaria is so deadly and has severe consequences, not just in terms of, people dying from it, but also people having severe health issues throughout their lives. So hopefully we can overcome some of the political challenges to making sure that these are widely distributed and that people feel informed and trust the people who are providing these vaccines so that they will take them up and communities will be protected from this disease.
Kim, it's such an exciting moment, really, to have this vaccine, right? When we think about the potential contributions to health and well-being throughout people's life cycles, it's really an exciting moment, and yet one in which, as you rightly highlight, the politics around and the information around the distribution, the dissemination of this vaccine is absolutely essential and critical to get right for public health outcomes. And so our panelists today are talking about exactly these questions. How do you get a public health administration and infrastructure that's aligned with governance and messages, information to society that allows for trust and well-being and health. So this is a perfect moment to be listening to these sets of experts. I also just want to keep our listeners updated on the elections that are taking place in Liberia that were held on October 10th for the president. These elections were very closely contested, and they're the tightest vote differential that has happened since the country has been having elections following the civil war that ended in 2003, which is a really exciting moment for the country in that these were largely very peaceful elections. They were elections that are the first that were managed and governed and implemented completely by Liberia's own government without financial assistance or support from international partners. So they're highly competitive, highly contested elections that are really marking a democratic accountability. And indeed, these elections were seen as a referendum on the performance of the incumbent president, George Weah, who's a former soccer superstar for all those football fans out there on the continent and beyond. And Weah, the incumbent, secured 43.8% of the vote. And his challenger, so far, these are the unofficial results that are announced, but his challenger, Joseph Aboake, who is a veteran of Liberian politics and served as vice president from 2006 to 2018, received 43.5% of the vote. So every vote absolutely does count. The last ballots are still being counted, and revoting will happen in a few constituencies where there were a few irregularities. So these official results are expected later this month, but because neither candidate drew the needed 50% for a first round victory, Weah and Boake are most likely headed to a runoff, which would be scheduled for November. So this will be the exact same rematch of the 2017 elections, and very interesting moment and exciting moment for Liberia in this electoral accountability.
Agree. I love a good close election. No greater thing to be watching. And I don't know. I mean, I loved George Weah as a footballer. Not sure about him as a president, but I guess Liberians are also a bit mixed. So it will, again, as Rachel said, we'll keep following what's happening there. And we'll encourage our listeners also to go back and here's some of our back catalog where we had Rob Paley, right, talking about her award-winning book and trying to understand a bit more about Liberian politics, not just in the country, but in the international imagination, right? Because, her book, of course, looked at Liberians in the abroad, right? The Liberian diaspora and their connections to politics. And so certainly our listeners should check that out. But just kind of talking about the international, I did want to talk a little bit about world politics and the conflict in Israel and Palestine, as our listeners, I'm sure, already know, following a monstrous attack by Hamas militants into southern Israel on Saturday, October 7th, there's now a war and a severe humanitarian crisis in the region. And I want to draw our listeners' attention to a piece in Al Jazeera English written by Shola Lawal, in which she writes about how Africa is divided in its support, and demonstrating this at least through some of the rhetoric of various leaders on the continent, as she writes, as the death toll from the war mounts, African governments are wading into heated debate surrounding the conflict, with the continent split as different nations take opposing sides. Authorities in South Africa blamed the escalation on Israel's illegal occupation and desecration of the Al-Aqsa Mosque, as well as sacred Christian sites, in a statement on Sunday. And a top official, Zain Dangor, told local news channel ENCA that Hamas's bloody attack, while not a solution, was unsurprising, and that the conflict would not stop until the occupation ends. And so similar, she goes on to write that Algeria declared full solidarity with Palestine early on in the war. The African Union Commission under Musa Mohamed Faki, while expressing concern over the violence, has blamed, quote, the denial of the fundamental rights of the Palestinians, end quote, and called for a two-state solution. But importantly, she opens this piece talking about how Kenyan President William Ruto comes out, staunchly, right, in support of Israel, following this incursion into southern Israel. And so, points out that Kenya, Zambia, Ghana, and the Democratic Republic of Congo are among other African nations that have aligned with Israel's position. So we encourage our listeners to read Lawal's piece, not just, to kind of horse race, keep score, who's on what side, but to actually read about the historical context And because this goes back, right, to early support for Palestinians among African countries that had recently ended colonial rule, right? I mean, there's a museum, devoted to Palestine in South Africa, right? Like, so there's, what I think about this piece is it can provide our listeners some context for understanding why, we might see different African countries reacting differently to the war.
Absolutely, Kim. And such an important way of thinking about contested history and, having a lens to put some of this tragedy into context, increase our education and understanding while centering the humanity and keeping that first and foremost. So I want to also just bring our listeners up to speed on some of the developments that have been happening in Gabon. For those who are aware, there was a military coup at the end of August following the elections that had reportedly returned Ali Bongo to power. And so following the contestation around those elections that said Bongo had been reelected president, the military launched a power grab, a coup, and unseated the president, whose family has held power for more than half of a century. So this is really a critical moment. Of course, Gabon has an incredible amount of oil richesse, an incredible amount of corruption and election fraud, and the incredible amount of inequality. So we know that the number of citizens who live in poverty is really quite dire. And so in this sense, there seemed to be a celebration following the coup, for at least in the capital city, where citizens were seen embracing soldiers on the street.
Right. And I mean, these are all important points, right? When you hear of a coup, you're not, you like, I don't know, coups get a bad rap, probably because most of them are really bad. But this Gabon kind of challenges the way we think about coups, I think. It was a bit annoying for me to read like another coup in Africa. And I'm like, okay, but this one's different. Like, let's not lump in what happened in Gabon to the various coups that have been happening, in the Sahelian region, right? Like this is, Africa is not all the same, right? And I think the coup in Gabon is quite an example of that. Okay, so on the record, I'm not saying the coup in Gabon was good. I'm saying it's different. So listeners, bear with me. And part of what I'm saying is I'm not the only one saying it, right? So there's a really good kind of explainer that was written by a couple of colleagues at the U.S. Institute of Peace. We'll have the link in our show notes. So this was written by Archibald Henry and Elizabeth Murray, and they give some background on this. And I think and maybe it's not Archibald Henry, maybe it's Archibald Henry. Sorry if that's a French name and I'm mispronouncing it. But Henry writes, while military takeovers or coup attempts have become increasingly common in Africa over the last few years, the August 30 coup in Gabon is distinct from the recent coups in the Sahel region in a few ways. In Burkina Faso, Mali, and Niger, coup plotters stated the need to guarantee security from jihadist threats and called for independence vis-a-vis former colonial power France, enjoying popular support as a result. Coups in the Sahel have been followed by military juntas stark distancing from Paris and rapprochement toward the Kremlin and the paramilitary Wagner Group. In contrast with countries in the Sahel, Gabon has enjoyed relative stability in recent years. It's also maintained close ties and strategic relationships with France, China, and the U.S. Rather, the coup in Gabon occurred in the middle of an electoral cycle that featured accusations of fraud by the opposition and government restrictions on the internet and independent news broadcasts. More broadly, Gabon has experienced frustrations over authoritarian rule, characterized by resource capture and predation by elites, deep structural inequalities despite the country's wealth, and weak democratic institutions. So all of these things, Rachel, that you've already brought up, right? Interestingly, like all of these people in the streets is because like half of Gabonese live in Libreville, the capital, right? And you bring up, right, it's a resource-rich place, right? Not just oil, but manganese, right? There's so many resources, and on kind of like resource wealth, like folks could go back and listen to the Cyril Obi episode, but also read the paper by Nate Jensen and Leonard Wanchicon that's about resource wealth and political regimes, right? Thinking about like democracy and autocracy and how resource wealth can play into that. And like you say, like it's a country that should be rich, right? And you certainly see that in Ali Bongo's like beautiful mansion in Paris, right? Like, so like, and who knows, various other places. But you don't see that with a third of the population living in poverty, right? And so even though GDP per capita in Gabon is quite high, that wealth, or even let's not even say, well, let's say income, is not realized among the masses. So I want to also point our listeners to a piece that Ken Apollo wrote in his excellent Substack that folks should be following, right, an Africanist perspective. He talks again, like similar to Archibald Henry in the USIP piece, talks about the parallels between Gabon's coup and the coups in Burkina Faso, Mali, and Niger, that there's some French-influenced political underdevelopment and a deep dissatisfaction of, quote, meaningless ritual electoralism masquerading as democracy, end quote. Like, brilliant. And then in Ken's piece, he actually shares some fairly recent Afrobarometer data that shows kind of Gabonese dissatisfaction with the ruling government and where the country was headed. It's quite good. And I also like here the juxtaposition to Uganda that he writes about in his piece, right? Saying it's curious why the Bongos, right, this long dynasty that Rachel has talked about ruling for half a century, didn't build a credible autocratic mass party, right? Like, why didn't they create a political party, right? Rachel's award-winning book would tell you, like, this is what authoritarians do, right? They build a party, and then there's a way for them to then rule in this, quote, democratic era, right? But they didn't do that. And maybe, Apollo suggests maybe they had a sense of invincibility. They trusted their coup-proofing strategies, right? Having all of these various paramilitary forces that were supposed to keep the president secure. Or maybe they just feared that if they did build a political party, a mass party, that there would be a mobilized, educated, and already highly urbanized population that could challenge them in the future. And so, definitely read that piece. Know also that, the coup happened in August, but there was an attempted coup just a couple of years ago. So this is right when Ali Bongo was receiving medical treatment because he had potentially suffered from some stroke, right? There was like a lot of uncertainty among the Gabonese population, like where their president was and how he was doing. But the last thing I want to say on this is when I was watching the coup unfold, I was thinking a lot about Jamie Black and Nick Van de Wal's book, which is, it's not about coups. It's a book on elections. And what's really striking about their book, and you can go back in our back catalog and listen to the episode I did with Jamie about their book when it had first come out. But the thing that really stuck out to me is how important elections are, even when they are a farce. That there's something really powerful about focusing everyone's attention for just a brief moment. And even if you want to steal the election, right? And, the election itself, like, it's possible, right, that the population voted for change. We can't know. And maybe we will years to come. Someone will unearth ballots and we'll actually be able to count. And I don't know that anyone cares at that point, but except for me, because I'm a nerd and I love these kinds of things. But we can't know for certain if people had voted for change. But in the end, that's what they got. And we'll see if it's going to be real change. We haven't heard of a new election date yet, but time will tell.
Exactly, Kim. And what I think is so interesting is this contrast with with Uganda, as you raise, right? Like, why didn't the Bongo family create a mass party, as Museveni has done in Uganda, that bolsters support, that manages, the kind of authoritarian stability, and that is a vehicle for incorporation. And what Ken points out that I think is really spot on is the question of what that means for what comes next in Gabon, right? So, which is what you just raised as well, Kim. Like, the military is in power now. There's not an organization, there's not a party that could take the wheel, that could transfer into some kind of electoral politics that has strong linkages and organization across the country. And so, yes, there were elections, and there were elections that were a focal point, and change happened, right? But not through the kind of party competition and mobilization, because that is a vacuum and an institutional void. So that still stands as we look forward to what the options are ahead for Gabon in terms of a military transition towards civilian rule and what the possibilities are. So we'll definitely keep our listeners posted. Given the significance of these events, we're certainly going to be taking up the topic in coming weeks that will build on this country-specific analysis, and whether there are regional specifics that we can describe in the Sahel around questions of security, whether there are and how the Gabon case differs quite substantially around the kind of foundational structural factors that contribute to this moment of coup in each country. So thinking about these structural conditions and the ultimate question of governance and how governance and politics can improve or exacerbate well-being and health, as we started our conversation around the vaccine for malaria, we want to turn now to our very special episode with this panel of experts on public administration and health who were Mandela Washington Fellows at Cornell University this past summer. Take a listen. So our guests today are Ruth Sulaimon from Guinea-Bissau, Dede Barpeen from Liberia, and Gibson Mainaon from Kenya. I'm going to introduce them to you briefly, but I'm also going to give them a chance to introduce themselves. So Ruth, we're going to start with you. Ruth is a medical doctor, a neonatologist, and is passionate about mentoring and supporting teens. She wrote a book for youth about making good decisions, and she's also very interested in healthcare policy and especially innovation and technology. So Ruth, I'm wondering if you can explain some of your current roles, your work, and your own pathway in terms of how your experiences have gotten you to this point of being so passionate about health and well-being and public policy.
I'm Ruth Sulaimon, like she said, from Guinea-Bissau. I'm a medical doctor. I work in the neonatology care intensive unit. And I've been a medical director of a southern clinic in the regions of Guinea-Bissau. The experience has made me understand to some extent about public policy on health, and I've experienced a lot of challenges that made me so interested in venturing more into checking out about health policy. So I'm so glad to be here.
Thank you so much for joining us. And now we're going to move to Dede. Tell us about your experiences and how you became so interested in health in your work.
Thank you, Richard. I'm Dede Barpeen. I'm from West Africa, Liberia. Professionally, I'm a nurse, but I have interest in community health nursing and services. What I do is that I got attracted to the field of public health because of the alarming number of maternal and infant mortality in my region, Liberia, with Sub-Saharan Africa. And I've been working in my country to help my country achieve Goal 3 of the United Nations Sustainable Development Goal, which calls for a healthy life for people of all ages. And as such, women and children are my key priorities.
Absolutely. Thanks so much for being with us, Dede. And Maina, who, as we mentioned, is from Kenya. Maina is really passionate as well about survival and thriving in his Kenyan community, particularly as it pertains to youth. And he's working to support his organization, which is called Healthy Young Kenya, which is about teaching young people to empower themselves to engage in healthcare and building their capacity to do that within the community. So, Maina, tell us a little bit about your pathway and your experiences.
Thank you so much, Rachel, and I really appreciate the opportunity to be here today. As you mentioned, I'm from Kenya. I work as a pharmacist. I studied at the University of Nairobi. But from a young age, I have had passion for healthcare. I had the advantage of being brought up by a mother who was a community health volunteer. So I got to accompany her to visit people's homes and just developed a passion for healthcare. And where I come from, we have very limited access to healthcare. And the passion developed in me from a young age. So when I went into healthcare practice, I practiced for a bit, but I still had that fire in me to just help solve some of the community health challenges. And also as a young person, I felt the need to involve other young people. So through Healthy Young, we try and mobilize as many young people as possible, turn them into healthcare enthusiasts, and those who have passion and ideas and innovations that revolve around healthcare access. We try and build their capacity and empower them to do more for their communities in terms of solving healthcare challenges.
Absolutely. So as you can see, our listeners, we have three really passionate and expert panelists here to talk with us today. And I wanted to start out by asking each of you a big picture question. What is your vision of a just healthcare community and even a just, healthy, thriving world? Can you imagine well-being for humanity, well-being for individuals in a way that could be achieved by public policy, by governance? And you can talk about that like on a local level, on a national level, on an international level. But, if you had to describe to us your vision of what a thriving community would look like, how do we even picture a really healthy society? And then what does it take to get there? So Ruth, we're going to start with you.
Okay. Yeah, my vision about a just healthcare future, I would say for my background, that's Guinea-Bissau, is that when the well-being of humanity is at the core of public policy and government decision, when our leaders sees it as a priority, I believe it would be the starting point of having a just healthcare future. And some of the ways wherein we can achieve this is by having quality access to healthcare. And most times where I worked in the region, the clinic was very far from some people, and so most time people come in with complicated issues and they end up dying. But having quality access to healthcare will be one of the means to get a just healthcare future. Another way is for the leaders to focus on preventive measures, because most times they try to treat things, but if we do the awareness and so on in the community levels, talk to them, I believe is a means where we'll prevent most of the death we receive in the hospital. And lastly, for how I envision a just healthcare future is Africans embracing technological advancement, because lack of technological advancement has led to the death of many neonates, which we are in our work, and it's so sad most times. And so if our leaders, healthcare providers, organizations, NGOs can embrace this technological advancement in Guinea-Bissau and in Africa as a whole, I believe we will have a just healthcare future.
I love that. And your pillars there that you've described are so interconnected. It makes perfect sense, right? Because the access allows better prevention, better preventative skills and caring, and the community awareness allows then also embracing technological advancement. So really thinking about how that, if it's taken up at the leadership level, at the community level, and then how those are so interlinked across awareness and prevention and a healthy future. So thank you, Ruth. Dede, what about you? How do you picture just a healthy future?
For me, I see the just health system as a system that is driven by policy. It's also human-driven because if you have a policy that supports health, talking about equity, where every citizen will have equal share, equal access to healthcare services, it makes it a better environment for one to live in, and be free of illnesses. Let's take for instance, in Africa, where I come from, you visit healthcare centers, there are no drugs for patients. Patients will walk odd hours, they walk distances, they walk miles to get at the facility, and healthcare practitioners would only screen patient and give them prescription. And these are people who cannot afford $1 a day to eat, right? So it brings about inequality in health, right? And also just a health system. I also look at quality trained professionals. Because on the African continent, we are challenged when it comes to specialists. That's why you see more often those who are at the economic class, whenever they have issues, they fly abroad to seek health care because we don't have the, quality trained health practitioners. And also, one thing I also see to make this system a vibrant one is to have a strengthened referral pathway, a strengthened referral system that involves the community themselves, community taking initiative of their health, doing timely referral. And I see that once timely referral is done, the issue about community death from pregnancy-related conditions, can be minimized at the level of the community. And lastly, when our leaders themselves see health as theirs, and take away the ideas of flying abroad for treatment and invest into the health industry of our individual country in Africa, like Makodi said, having the latest of technology, having a specialist, with that, our community will be safe and prevented from preventable illnesses.
Absolutely, absolutely. Those pillars are also, very similar, and also, thinking about the specific ways in which referrals from the community relates to community awareness. Yeah. Right? Knowing what pathways are available to you, which are recommended, and having everyone agree on this route is so powerful. Maina, what about you? What do you envision?
So for me, I see healthcare as one of the things that's really integral as a foundation of society development, because if people are not healthy, then they are not able to participate in society, they're not able to add value. And I look at, for example, how young people in this fellowship, the Mandela Washington Fellowship, are able to cause change in their communities. So I think about healthcare from that perspective, that if people are not healthy, then they cannot be empowered and they cannot contribute to their communities and to generally the economies as well. So like my colleagues here, I've been to places in Kenya where the nearest facility is more than 4 hours away. I've done free medical camps as a volunteer, and I've gone to places where some people are above 40 years and they have never seen a doctor a single day in their lives. So that speaks a lot into the level of healthcare inequity that goes around in my country. And there are a lot of people in that community who, because they don't have access to healthcare, either they were unable to reach some level of education, or they were not empowered enough to cause change in their communities as much as they would have wanted to. So I see healthcare from that perspective, first of all, in terms of access. So for me, a just society or a working society, or my vision of the future, is to have everybody, regardless of where they are located, having access to healthcare so that they can be able to add value to their communities. They can be empowered enough to participate in their societies. And secondly, as well, is the aspect of youth involvement. Last year, my co-founder and I, in January, we did a study in Kenya about the level of youth awareness and involvement in healthcare. And our results were very shocking because we found around 60 or to 70% of Kenyans, they have a negative attitude towards healthcare. And a lot of them, even if they were willing to participate in healthcare, they don't know what they can do. So there is very minimal youth involvement in healthcare. And as you can see, young leaders, they have potential to participate in innovation. And every sector intersects with healthcare in a way. Climate change intersects with healthcare. Law and every other sector, even infrastructure, they intersect with healthcare in a way. And when young people have the consciousness that there is something they can do to improve healthcare in their communities, they don't have to be healthcare workers, but regardless of whichever field they're in, there is some value they can add towards healthcare in their communities. So those two aspects are what I see as, kind of an ideal society where, first of all, people have access, and secondly, we have a lot of youth involvement, objective, innovative, and youth involvement in terms of solving community health challenges.
Absolutely. As we know, the youth, our young leaders, they have the passion, they have the energy, right? Often they have time and real ability to contribute. And so being able to channel that into ways that connect social needs with health, as you said, they're absolutely connected across all areas. So I think that's really powerful. So now I wanted to ask each of you, what do you see as some of the greatest challenges to realizing this vision? And on the flip side of that, what do you see as opportunities? When you're doing your daily work, when you're interacting with communities, with public policy officials, how are you seeing ways to advance to create this more healthy human future? So constraints and pathways forward. Ruth, let's start with you again.
One of the greatest challenges that can endanger us having a just healthcare future, I believe, is the complexity of healthcare landscape, because in Africa, I don't know about it, the health system is mainly influenced by political factors and economics and social dynamics. So navigating this issue is very challenging. And the opportunity I see to overcome this is maybe like it's like every system being involved. Like we have in my country we have the Ministry of Health, we have WHO that is actively involved, and so if they are involved and the community too are involved, I believe is an opportunity to be able to conquer these challenges.
Mm-hmm. Absolutely. That kind of the starting with the leadership or the prioritization, but also how much integration you need across sectors. And I think this relates to Mainer's point about, infrastructure has to be designed with health in mind, water treatment, waste management, accessibility for walking and transportation. All of these elements are infrastructure, and the result is health and well-being, right? And so, as you're saying, across the ministries, across different domains, to really have that common focus is absolutely key. Dede, how do you see it?
On that, I want to make a specific reference to the issue of maternal infant mortality. Currently on the African continent in Sub-Saharan Africa, Sub-Saharan Africa accounts for 70% of maternal death across the world. That is an alarming number, right? So it tells you that the African health sector is challenged. It calls for more support. It calls for training of health workers. It calls for a better community approach to health. And I see that the willingness of the community is also one challenge, because in some communities in Africa, there are certain things you don't say there. It is taboo. And because of that, people are not willing to, adhere to certain health issues. So the issue of support to infrastructure, health infrastructure, is an issue. The lack of drugs are hospitals, quote-unquote clinics, is a serious issue confronting a just health system. And what can we do? With all of these challenges, they are still prospect for growth, right? The good side of it is that we have tried as much as possible as health worker to, reduce the issue of maternal death, even though it is alarming. Individually, like for my country, we were around every 100,000 live birth in Liberia, 1,072 mothers die. Right, but based on community engagement and work, right now we are having 742 maternal death on every 100,000 live birth, and why we are also recording 76 infant death, from every 1,000 birth in Liberia. So there are still prospect for the growth and development of health if we can get the necessary support, have the necessary educated people. I see this as being very necessary to the process.
I just wanted to add that one of the challenges too we have is that it's lack of education, because most time the educated people in the capital of my country, they have easy access and they know the importance of going to the hospital, of doing antenatal for the pregnant women. And they know that if they see any different sign on their babies, they should take it. But I had a different experience when I was the medical director of the region. I discovered that most of the time, the pregnant women, they don't come to the hospital the 9th month. And you discover that they either have high blood pressure, they have eclampsia, they have different issues. And they die not just because health access is not there. They die because of lack of education and not knowing the importance of this. So I think if we invest in education a lot, people will get aware. They will learn it in school and they will see the importance of health. I think that's another challenge.
Absolutely. So, and before we come to Maina, I wanted to ask all of you, one of the statistics that Dede was mentioning on the high level of infant mortality, what do you think are the leading causes of that infant mortality? Is it largely about water, access to clean water? Is it largely about access to the medication that might be necessary? Is it about awareness and coming to the clinic and, having access to the clinics themselves? Are there some kind of more easy or let's say low-hanging fruit that, you would really bring down the infant mortality rate from where it is now that you see?
Yeah. So I want to come in with that. There are key factors influencing the high, infant mortality rate. In my case, we have the issue of water and sanitation. It's a serious challenge. We have malaria, diarrhea, and pneumonia. These are three major illnesses, that are causing infant mortality rate in my country, and also pregnancy-related conditions. Like Ruth said, medically we advise pregnant women to visit the health facility at least 4 times, before they give birth. But more often you wouldn't see the woman wouldn't be interested visiting the facility at the first time to confirm that she's pregnant, right? And the next time you're going to see her is delivery, right? And between that, there can be complication along the way. And whenever the person comes in late, it becomes an issue. But how can we resolve this? Now, in Liberia, we are using the community health approach, that is the National Community Health Assistance Program. So the National Community Health Assistance Program is designed to provide health to people living beyond 5 kilometers who cannot have access to her facility. So we train them in 4 separate modules. Module 1 talks about preventive health, where we provide health education to them. We teach them about health education. Module 2, we look at maternal and reproductive health. What are those things the community health workers should look out for in a pregnant woman, in a child, family planning, issues. We also talk about child health, where we place serious emphasis on malaria, diarrhea, and pneumonia. So these community health workers are trained in these 3 conditions. So whenever a child gets sick at the level of the community, right, that mother needs not to work 3 to 4 hours assessing the health facility. So the community health worker is already equipped and is there to treat that particular child. If the community health worker cannot treat that particular condition, if there do exist danger sign, we often advise them to do prompt referral. That's why I spoke about a strengthened referral system. We already have the health system, and we'd also talk to them about the special cases like the NTDs, neglected tropical diseases like HIV. We talk about let's say mental health. We talk about lymphatic filariasis. Because these are conditions that are forgotten, and many persons are now looking into that. So we are using the community health approach as a means of solving some of those low-hanging fruit at the level of the community.
Like Dede said, definitely there is an element of maternal mortality and infant mortality, which is related to how many visits the pregnant women visit their facilities. But in 2021, I did a study on birth asphyxia. That's the complications that follow birth. So one of my conclusions was that one of the biggest factors that affects the variations in infant death in Kenya is the quality of obstetric care. And because I would notice there were very few or no statistics on birth asphyxia in the US, for example. But in Kenya, it's one at every, forgive me. So, but in the statistics for birth asphyxia in Kenya are 2 out of 10 births. So you notice there is a sense in which we need to improve the quality of obstetric care. Also, the statistics I had showed that in private hospitals, there was almost no incidence of birth asphyxia compared to public hospitals, where the quality of obstetric care is also a bit low. So there is a sense in which our governments and our populations need to improve the quality of care and to standardize it in a way. One of the things that our former First Lady in Kenya did is she ran a campaign that was called Beyond Zero campaign, which was aimed at ensuring there is zero mortality for infants and mothers. And in fact, when I was doing my internship in a hospital, there was a consciousness that was developed in us. If you are rotating in the obstetrics department, you have to be extra careful. And if there was a single mortality in the maternity, in the obstetrics section, the whole Ministry of Health would crack down on the hospital. It would be on the news, even if it is a single mother or a single baby who died. So because of how much the First Lady had put in a lot of money and a lot of investment in it, so we knew in the maternity you have to be extra careful. And if there is a single mortality, there is a whole meeting that is held by the Ministry of Health to discuss how to avoid that. So there is a lot that can go into improving the quality of obstetric care and the consciousness that providers have, especially when they're handling such cases.
And that really harkens back to what Ruth was saying around, the prioritization of leadership. This example of the First Lady, right? Someone really saying, this is a priority for us. This is an administrative priority. And then the level of scrutiny, education, hopefully resources that follow that as well. So Maina, I wanted to return to you with the original question in terms of what you see as challenges and opportunities in creating that just health future.
Sure. Actually, my thoughts have already been preempted because really, definitely we have challenges in terms of resources, in terms of political goodwill. But overall, the key challenges that I have faced is what we've just discussed about the prioritization of healthcare, where healthcare is not seen as a need. If you look at the allocation of resources and budgeting, healthcare is way low in terms of a priority, in terms of percentages. Mm-hmm. So that means that there is a sense of consciousness we haven't developed yet in Kenya and in Africa at large, where healthcare is a priority. We haven't seen it in terms of how it cascades into the effects of healthcare in the community, in terms of it affects real lives, it affects real economies. So we haven't really gotten to a point where we prioritize it, and we have to fight as the healthcare sector to get some budgetary allocation and to have resources given to us. And secondly, it's in terms of policy implementation. I look at Kenya, for example, and when I look at policy documents in health, we don't have a shortage of policies. We don't have a shortage of strategies. In fact, other countries come to benchmarking Kenya in terms of policy, in terms of healthcare. But in terms of implementation of those policies, that's where we have a big gap. We don't have political goodwill. The policies exist on paper, but if you look at what's happening on the ground, there is very little translation of those policies into action. So prioritization of healthcare and the implementation of policy is some of the key challenges that we face in the healthcare sector. And in terms of solutions, I think there is a lot that can go into awareness, for example. If people know that those are a challenge, part of the reason why we don't have as much prioritization is because maybe even the citizenry and the people who are being served, they are not aware of some of those challenges that we have. They're not aware that they are being shortchanged by the politicians in terms of policy implementation and the allocation of budget. So if we have enough noise going into that space, if we have enough young people and advocacy going into healthcare, and people know that there is something leaders can do, I believe that there is a lot that we can change through giving people information, giving people the data. When you know that there is a very high rate of maternal death, for example, in Liberia, you know as a citizen, maybe there is something I can do about it, as opposed to the information just lies around in the national government statistics and is not cascaded down into the citizenry. And secondly is about capacity building for young people. As you've noticed, I'm very passionate about building capacity for young people. I believe there's a lot of potential in young people to make change and to just put their leaders to make their leaders accountable, and to just sometimes even in contribute in terms of innovation that can improve healthcare. Digital health is one of the big areas that we have innovation and young people going into that space. So if we build capacity for young people, young leaders to go into the healthcare space and to contribute solutions, I believe that's one of the ways that we can solve the biggest bulk of healthcare challenges we have in our country.
I think that's so critical what you're saying. In particular, there can be policy on the books, but the question of implementation, absolutely. And also, as you note, Maina, the kind of, as your opening comment suggested, that prioritization and resources into the healthcare system have long-term return on investment, right? If we're prioritizing health and well-being of our society, of our fellow citizens, that has good outcomes for economic development, right? And all of these downstream indicators. So it can be very kind of, financially good policy to invest in health, and you end up spending less later on emergency circumstances, and you have better labor capacity and the like. And so, I think from a public policy planning position, healthcare is so fundamental. It's absolutely critical. So I'm wondering how you all see, there are a lot of debates around pharmaceuticals and the production. I mean, Dede had mentioned that, sometimes lack of drugs, access to the right medications is an issue in some of the clinics. How do you see this kind of global debate about access to medications, patents, and whether or not pharmaceuticals could be produced locally? How do you guarantee that you have the right medications available? Are there ways forward in this access to drugs question that you see as applicable in the context? Maina, I'm going to start with you.
Thank you. I'm a pharmacist, so I should definitely have more insight into that. And my comment would actually be that sometimes in Africa, we are our own enemies. You find that some people ask me, you're a pharmacist, why don't you go into production? But you realize if you were to start your own production and to make drugs locally, you imagine that would be cheaper. But drugs can be imported more cheaper from China and from India than the ones that we make locally. In June this year, we passed our finance bill, which which actually increased taxation on importation of raw materials that are used to manufacture drugs. So we are basically making it even more expensive to produce drugs locally in Kenya. So you find we have to rely a lot on foreign countries, and during scenarios like the COVID pandemic where importation was affected, so drug prices went very high. So we are not doing enough as a continent, and I would say especially for Kenya, to make drugs more affordable. We are not doing enough. There is more that we can do. We can lower the charges and the taxes on importation of raw materials. We can fund research. My undergraduate research, for example, was about a plant. I was studying a plant and trying to see whether it can be used to treat diabetes and asthma. Well, I was doing that for undergraduate reasons, and my conclusions were that it can actually be used. And a lot of research papers in the University of Nairobi, they reach such conclusions, but nothing is done beyond that. So drug discovery ends at that point because we don't have enough investment in research. So there's a lot that can be done, and I believe we are our own enemies. We create policies and structures that don't support African production. So if we can maybe reduce some of the levies and support research, those are some of the ways that we can make medication more accessible and more affordable in Kenya.
Absolutely. I mean, that's really interesting, both on the research and development side, as well as being able to import materials that would allow for local production in a way that makes it more accessible. That's very, very key. Ruth or Dede, do you want to jump in on that question?
I could talk a little on that. Gibson is a pharmacist, Ruth is a doctor, I'm a nurse. So for the issue of drugs production, for me, the way forward I see is that these companies, that are taking materials from Africa and producing it into commercial activities for African. If they can pander with Africa, right, to have these drugs locally produced, it will really help our system. Let's take, for example, my country, Liberia, signed an agreement with Firestone. Firestone is an American company, right? Liberia is noted for producing rubber across the continent. Signed 100 years contract with Liberia since 1926. And since 1926 up to now, there is no one rubber production factory in Liberia, right? Same applies to the issue of drugs, right? So these materials have been extracted from Africa, produced in the West, and yet comes back to Africa with exorbitant prices. Mm-hmm. So it makes it very difficult for us.
Absolutely, absolutely. I mean, especially when we think about like the innovations that Maina was describing with a particular plant, what's possible, and then who has access to it once it's discovered, and then patented.
And another thing, even Gibson, if Gibson succeeds on that, right? Where does it get the support from?
Mm-hmm. Exactly.
The infrastructure is not available, right? So the technology is not available, so it kills his dream.
Mm-hmm, yeah, mm-hmm. And discovery.
So that's why partnership is important. Yes. So if the international companies can partner with the local ones, burden their minds, and do the production at the local level, mm-hmm. surely, our hospitals, our clinics wouldn't be empty of drugs. Mm-hmm. We wouldn't find it difficult, importing drugs into our individual countries.
I'll just add to it. I agree with Gibson, that we can produce our drugs locally, but I think that would be a long-term goal because we don't have everything yet in place. So, but it's something Africa can look into it and then plan towards it, because one thing is to say it's possible, another thing is to make plans towards it. And so, for the short-term goals, how we can solve the drug issue, I believe is to invest in it, get funds for it for now. That would be the present solution for it.
Mm-hmm. Absolutely, absolutely. So now I want to turn to our last question, the question that we ask all of our guests on the podcast, which is, what are you reading that you'd like to share with our audiences? What would you like to recommend that you think our listeners might want to hear about? Maina, I'm going to start with you.
Thank you so much. So I'm really reading something that's completely non-medical. It's a book that I read in 2017, but I'm rereading it. It's Harper Lee's To Kill a Mockingbird. So it's an American classic. I believe most people have read it. But when I was traveling to the US, I just decided to reread it and to reconnect with the kind of authorship in the book, because it opens your mind. It helps you to. One of the quotes in the book is about thinking from the other person's perspective. And just today we were going through a session on the danger of a single story and how you need to consider various perspectives. So it's very interesting to look at, America and generally the world from various perspectives. And just to interact with the various historical injustices that have been there in this country and to learn from that. I believe that it's quite an interesting book to read. I just that I know most people have read it, so not really a recommendation, but it's a really good book.
It's a great recommendation. It's something that people can resonate with and come back to at different points in their lives, to take different messages from it. Dede, what about you? What would you like to share with our listeners?
For me, I'm reading what is related to healthcare policy. As someone who has lots of passion for community health, building a resilient health structure comes with a lot to do, right? So I would love to recommend my listener to catch this article, the Ama-Ata Declaration. Read the Ama-Ata Declaration. It encompasses every other thing that needs to be done to make a vibrant health system. In the Ama-Ata Declaration, it talks about equity, it talks about the structure of primary health, it talks about, technology in health, and it talks about, specialty. So if we can redirect our attention to the Ama-Ata Declaration of Health, it will help our individual health system. Thank you.
Thank you for sharing that. That's a great recommendation as well. Ruth, what about you? What are you reading?
I'm reading something not related to health, but is The Millionaire Fast Lane, written by MJ DeMarco. What I will I think it's a good book for we Africans, because most of the time we think about we don't have the opportunity, we don't have the money, we don't have the support and everything. But the book tells me that fast lane is a lifestyle, is a choice, you understand, is a commitment of blended beliefs, process, and action. So if we can change our mindset, I believe we can get the resources, we can make the things we need, even in Africa. So the book is kind of an eye-opening possibility. You don't need to, it's good to ask for support, but what can you do where you are right now? So I recommend the book to my listeners.
Thank you so much. That's a very powerful recommendation to leave us with, the ways in which this institute, the Mandela Washington Fellows Institute, is really at base exactly what you're saying, right? It's a way to think about what can we do in the places that we are as we look forward in the communities that we interact with, and how can we make a difference with our skills, our talents, and our time and our energy and our commitments. So I want to thank each of you for sharing those commitments and expertise with us and sharing your thoughts. It's really wonderful to be with you here each today. Thank you so much.
Thanks for listening to this week's episode of Ufahamu Africa. You can find more episodes, show notes, and transcripts on our website, ufahamuafrica.com. This podcast is produced and managed by Megan DeMint, with help from production assistants Chukwufunanya Ikechukwu and Ami Tamaklo. We are generously supported by the Carnegie Corporation of New York and receive research assistance from Cornell University and the University of California, Riverside. Our music is courtesy of Kevin McLeod. Until next week, Safiri Salama.